Hello everyone. Welcome back to Human Health Heaven. Today, we have an intriguing and informative video in store where we'll be delving into the anatomy of teeth. We'll explore the structure and function of teeth and understand why they are crucial for our overall health. So, without further ado, let's get started. Teeth, these are of 4 types. There are whip teeth in the front of the mouth or in the middle of the jaws. There are 8 of them, 4 above, 4 below. Their tusks stand erect. These teeth have sloping edges similar to the shape of ricani. Their flat edge is sharp for cutting. Their neck is narrow, and the root is long, solitary, pointed, flattened transversely and grooved on the sides. There are 4 cusps, one around the whip tooth. These whips are bigger and stronger than teeth. Their dental root is long and convex. The apex is large, conical, the lip aspect is convex, and the tongue aspect is somewhat hollow and rough. Their end narrows and ends in a blunt tooth tip, and it protrudes beyond the flat line of the dentition. The root of the false tooth is conical, solitary, and grooved. These are also often known as teeth lions. There are 8 premolars and are located behind the incisors in 2 numbers. These are smaller than penetrators. Their peak narrows from front to back. On the forehead of the spire there are 2 pyramidal cavities separated by a groove. In these, the bulb on the side of the lip is larger. The dental neck is oval and has 1 root, except the upper first premolar, which has 2 roots. The molars are the largest of the permanent teeth, have broad crests, and are specially adjusted for chewing activity. Their number is 12, 3 on all sides after the premolars. Their peak is cube-shaped. Their inner surface is convex and outer surface is flattened. There are 4 or 5 grooves on the tip of the tooth. The cervix is clearly large and round. The first molar is the largest and the third, wisdom molar, is the smallest. The molars of the upper jaw have 3 roots, of which 2 are towards the cheeks and the third towards the tongue. The teeth of the third molar are often fused together. The lower molars have 2 roots, one at the front and one at the back. There are 4 major types of teeth, each differing in structure and function. In a person's mouth, the front teeth provide the primary cutting edge at the front, leaving the last part of the dentition as the front teeth, while the molar teeth are located towards the back of the mouth. The gum is a soft, jewel-like structure around the teeth that holds the teeth together and provides them with stability. Gums help in chewing, grinding, and swallowing food. It also plays an important role in protecting teeth and maintaining oral health. It protects the roots of the teeth through exposure and provides them with solidity. Taking proper care of gums is primarily important for the health of teeth. Dental root provides ground-like stability to the inner part of the tooth and connects it to the roots. The root of the tooth is located beneath the gums and protects the tooth from the effects of roots and bacteria. It provides stability to the tooth in the ground and keeps it strong. Enamel. This is the uppermost layer of the tooth and provides external hardness and protection to the tooth. It plays an important role in protecting the teeth and provides protection against food and drink substances. Its valuable quality makes it special for cutting and digesting teeth. To prevent enamel damage, good care and regular dentist checkups are essential. Dental pulp. It is a soft tissue located inside the tooth which contains nerves, blood, and nuclear vacuoles. Dental pulp contains nerves and arteries that supply sensitive parts of the tooth and help keep them alive. It helps the tooth feel cold or hot and plays an important role in maintaining its structure. Gingiva is the soft tissue around the teeth that protects the teeth. Gingiva connects the gums to the ground and provides them with stability. It plays an important role in preserving the teeth, enabling them to maintain their structure and position. It is called the crown of the tooth. It is the upper part of the tooth that is outside the mouth and is usually covered by enamel. The crown of the tooth is the part that we see most and is the part that is easier to touch when eating. Supports function. It is the thickest part of the tooth and is often the center of care for tooth health and support. It is called the stone of the tooth. It is the structure of the tooth fiber which properly supports the crown of the tooth. The axis of the tooth is the main part which faces inward and in which the sensitive parts of the tooth are located. It helps keep the main structure of the tooth strong and stable. Periodontal ligament. It is a complex tissue that keeps the tooth stable in its place. The gingival ligament connects the tooth to the gums and makes it flexible to the position of the tooth, which helps keep the tooth alive. This tissue protects, stabilizes, and supports the gum area of the tooth. Cementum is a hard tissue that helps in keeping the roots of the tooth fluid. Cementum keeps the root of the tooth strong and stable and helps in the stability of the tooth. It is able to maintain the structure of the tooth. Plays an important role. Dental cavity. This is a disease in which a hollow is formed on the upper surface of the crown of the tooth due to caries. This disease is caused by bacteria that damage the crown of the tooth when food is not suitable for treatment. If the hollowness of the tooth is not treated timely, this problem can become serious and can cause further damage to the tooth. Dental root canal. This is a medical procedure in which the accumulated dental particles in the root space of the tooth are removed and the canal is cleaned. This medical procedure is usually performed to treat toothache and other problems when the pulp of the tooth becomes infected or the inner part of the tooth becomes damaged due to some reason. To keep teeth healthy, their look is important. In brief, the important points of dental protection are cleaning with toothpaste or brush in the morning and evening, washing mouth and brushing teeth after meals, massaging the gums. One should learn how to keep a toothbrush and change the brush after a month. Picking teeth is bad and gargling after eating anything is a good habit. A balanced diet and good nutrition, especially consumption of foods rich in vitamins A, D, C, and fluorine, are essential for dental health. Eating hard things like sugarcane, raw vegetables, fruits, etc. is beneficial for dental exercises. That wraps up our video on the anatomy of teeth. If you found this video interesting, don't forget to hit the like button and be sure to subscribe to our channel for more insightful content. If you have any topics you'd like us to cover in future videos, please share them in the comments below. Thank you for watching, and I'll see you next time.